What do you know about the Affordable Care Act, aka Obamacare?
The Affordable Care Act, also known as Obamacare, is something that I'm very familiar with. I run a large health system. We see thousands of patients every day, and we have a responsibility to A, understand the law, B, implement the law, which means we're responsible for delivery of care in accordance with the law, and C, we're responsible to identify patients that are coming to our facilities that could be eligible to have insurance through the Affordable Care Act and help them to sign up for that insurance and understand what it means to them. So we've been implementing the law on a daily basis since it went into effect.
How does the Affordable Care Act affect the national health care for people?
In regards to the national health care, this is a national regulation, a national law that's being administered locally. So it's one of the few things that's happened, at least in my 30 years of healthcare, that is an attempt to try to make sure that all citizens, U.S. citizens, have health care. So it's only national if it's handled properly on a grassroots area, and so we do our part within Central Indiana.
Have you personally been affected by Obamacare?
If personally means how have I been affected because it's applicable to me, no. If personally is because of my role in running a health system, yes, I have been affected dramatically.
And that took care of the next question. The last one is, as a result of how you or your business has been affected, do you support or oppose the Affordable Care Act?
In regards to the Affordable Care Act, I support it. I support it because I have to. My job is to implement it. But more directly, those people who have insurance assume everybody else has insurance, and that's just not true. And when you don't have insurance, then you typically put off any type of normal preventative care, whether those are well child visits or going to see annual checkups or having maintenance for chronic illnesses that you have. You typically don't do it. And you end up saying when you needed health care, it gets real bad and you go to emergency room. That's not health care. That's rescue care. That's emergency care. So the idea that people now have health care, then as they come in our emergency room and we identify they don't need to be there, then we assign them to a primary care physician, a family physician, or a pediatrician, or whomever, and make sure that they know how to access services there, how insurance works, and to identify their health issues and help them manage their health care. So I can tell you firsthand, we've seen patients that have benefited and are healthier today than they were before due to the Affordable Care Act. People can have their own political opinions as to whether it's good or bad, but from a practical, operational standpoint, it is good for U.S. citizens.
Thank you.